Good morning, my name is Erik Dorf. I am an orthopedic surgeon with Vail-Summit Orthopedics and Neurosurgery. I'm here with Vail Valley Live to do some question answering. We've had some questions submitted and I'm excited to get started. My specialty is upper extremity surgery. I do primarily hand, elbow, and shoulder, but of course in the wintertime, we take care of all sorts of injured athletes, including tibias and femurs and hips and ankles, and I'm excited to be here. Okay, we have all of our questions which have been submitted from the studio audience in our handy dandy Lang XT90 blue boot. What is a rotator cuff patch? Is there any benefit to the patch over traditional surgical repair? That's a great question. Rotator cuff surgery is one of my favorite operations. I love it. Patients do great. One of the most difficult things with rotator cuffs is that some rotator cuffs are completely torn and some of them are partially torn. Well, when they're completely torn, the decision making is easy. We just fix the rotator cuff. But what do you do with a rotator cuff that's partially torn? In those instances, sometimes we'll actually complete the tear and then fix the rotator cuff. Other times, before we had the patch, we didn't have any other options, so we would just leave it alone and hope that it wouldn't get worse. Well, the rotator cuff patch actually gives us the opportunity to put the patch on top of a partial thickness rotator cuff tear, and then the rotator cuff actually invades that patch and grows together and gives us a great option for patients who have a partial thickness rotator cuff tear. It's completely changed my practice and I love it. I've dislocated my shoulder multiple times. Should I give up snowboarding? The answer to that is absolutely not. The reason we do take care of patients who have dislocated their shoulder is so that we can get them back to the sports that they love to do. So if you've dislocated your shoulder multiple times, yeah, you probably are going to need surgery on this. If you've dislocated it more than once and you're young, almost for sure you're going to have to end up having an operation on this. So there are a number of things that we can do. One of them is we get you into physical therapy to work on strengthening some of those muscles around the shoulder so that it doesn't dislocate as easily. There are braces that we can wear. So for example, if you're in the middle of your season, you don't want to give up your season, we can get you in a brace and then perhaps get your shoulder fixed in the spring. And then of course, shoulder surgery for dislocated shoulders is a really very successful operation. What is wide-awake hand surgery and who qualifies for it? That's a great question. We do wide-awake hand surgery for anybody who needs basically a minor procedure that is anywhere between basically here and here. So skier's thumb, fractures of the hand, fractures of the fingers. There's a lot of elective surgery that they do wide awake, and basically it's anybody who doesn't want to go to sleep for their procedure. Another reason I really love wide awake hand surgery is we can talk to the patients during the operation and tell them what we're doing, show them what we're doing. They can see how much we care about what we're doing and what a detailed job we're doing and trying to make them better. So it keeps everybody in the operating room on their toes. And the patients really seem to love it. And they don't have to have any anesthesia, so they're awake and they leave the operating room and then they go back home in 15-20 minutes and no effects of anesthesia. It's great. I fell and jammed my thumb. How do I know if this is just a sprain or something serious like skier's thumb or a fracture? So that's a great question. How do you know if something is serious? There's a couple of things. People always say, oh, well, I could move my hand, so I knew it wasn't going to be a serious problem. That's not necessarily true. Anytime you've got a lot of swelling, I think that's an indication that there's a structure that's been damaged in there. So that's one thing that can give you a sense that, okay, there's something really bad that's going on. If you've lost sensation in your tips of your fingers, that might be something you would want to get looked at. If, on the other hand, you're using your hand pretty normally, it didn't swell up, it's not big and black and blue, then that's probably something you can wait and see. Ice, anti-inflammatories, immobilize it for a couple of days with a simple brace if you've got access to something like that, and see how it goes. For the most part, we're available all the time to take care of these little minor bumps and bruises. If you're concerned or if you're here on vacation and you want to get something looked at, we've got an office in Vail. We can certainly get you in, take a look at it, get an x-ray, make sure we're not dealing with something. And then you can sometimes move forward with a little more confidently with your vacation or with your season, knowing that you don't have an injury. Skiing is aggravating my tennis elbow or my elbow tendonitis. At what point should I consider surgery? First of all, conservative management for tennis elbow is a very effective treatment. So we oftentimes start with something very simple like a brace. Come on in, I can show you exactly which brace we use for that. Injections for tennis elbow work really well. So a lot of times we can get you through, or at least get you through the acute phase of tennis elbow with an injection. We send a lot of patients to physical therapy for tennis elbow or lateral epicondylitis. That does really well. Surgical management is really reserved for people who fail all of these conservative treatment modalities. Another option that we have for patients who don't want to do surgery is PRP. So we do PRP in our office. We've got a great guy who does biologics with us, Dr. Matt Nurkey. So I send a lot of patients to him before we proceed with operative management. And somebody who fails all of these different treatment modalities would then be probably a candidate for operative management of their tennis elbow. The downside of surgery for tennis elbow is that there is a significant amount of time off, and people around here do not like to take time off. So we try to treat these as conservatively as we can and move to surgical management of these overuse injuries only when we really need to. This is Erik Dorf. I'm orthopedic surgeon with Vail-Summit Orthopedics, and this has been the Ask the Doc segment with Vail Valley Live. Thank you very much for all of your questions. I hope that you got some answers.